The clock is ticking for Baylor Scott White to negotiate a new contract with Blue Cross Blue Shield of Texas Health Insurance. If they don't reach an agreement in the next couple of weeks, patients could feel the impact. KVUE's Isabella Basco shares what patients need to know.
There's a deadline looming for Baylor Scott White Health and Blue Cross and Blue Shield of Texas. By July 1st, the hospital system and insurance company need to negotiate a new contract, or else Baylor Scott White will no longer be in network for Blue Cross and Blue Shield customers. If the negotiations don't work out, the consequences are concerning to patient advocate Belinda Montgomery.
It sounds like it's months and months of backlog and misinformation and not understanding if when you're going to an appointment, if it's going to be covered.
We reached out to Blue Cross and Blue Shield of Texas for an interview. Instead, they sent us a statement which says in part, Baylor Scott White Health notified us that they are terminating their physician and hospital agreements on July 1st, 2024, unless we significantly increase what we pay them. Both Baylor Scott White and Blue Cross and Blue Shield telling us they are negotiating in good faith to prevent any disruptions. So far, Montgomery doesn't have faith in their timing.
Not knowing that until July 1st, when it's, already almost mid-June, I just think it's unreasonable, and I think they should do better. A delay in care means a delay of education for what might be going on with them, and it's a delay in fixing it or making it better. So it's just kicking the can down the road.
Montgomery says this happens all the time. Last year, Ascension Texas hospitals and Blue Cross Blue Shield were in negotiations that could have resulted in the company dropping Ascension from its in-network coverage. They reached an agreement.
They're not putting the people first, and when you do that, it really is a detriment to the whole system and the confidence people have in the system.
Montgomery recommends Baylor Scott White patients who are insured under Blue Cross and Blue Shield fill out a continuity of care form so they can have coverage beyond July 1st if a new contract doesn't come together. Blue Cross Blue Shield of Texas says members who are pregnant or being treated for a disability, acute condition, or life-threatening illness may qualify for continuity of care. In Austin, Isabella Basco for KVUE News.